Thank you for joining in for the webinar today. I am Asim. I'm the founder of UKRST. I work as a consultant neuroradiologist at Royal Preston Hospital. I'm here with my co-panelist and co-host, Dr. Abira Khan.
Hi everyone, I'm Abira. I'm ST5 at Oxford, and I'm subspecializing in neuroradiology.
Thank you. Can I just ask everyone to mute themselves, please? Okay, there we go. Right. Yeah, so we'll start the presentation now. We have got our radiology trainees, Mohammed and Dalia, who are entered at ST3 level and are doing very well. And thank you both, Mohammed and Dalia, for taking out time to do the presentation and helping our future colleagues. For all the candidates who are currently in the webinar, again, as a reminder, please keep your microphones off. Please keep your video off so that not to interrupt the presentation. If you have any questions, please put them in the chat box. We'll answer some of them as we go along. And again, there will be opportunity to discuss towards the end of the presentation. Okay, cool. Over to you, Mohammed and Dalia.
Thank you very much. Let me just share my screen. Okay, can you see my screen now?
Yeah, we can. Yeah.
Right. Welcome, everyone. My name is Mohammed. I'm one of the ST4 trainees in the Northwest, Mersey, and Liverpool region. I have started, I've joined the ST3 scheme 2 years ago. So I was in your shoes 2 years ago, exactly. Let me start by saying congratulations. You've made it so far. You already have the radiology knowledge. You have the experience. You just need to show it to the panel. And I'm sure you'll do well in the interview. You just need to prepare and practice. We're just gonna briefly talk about the interview format and some of the preparation resources that we've used. Give some examples, and there will be a question and answer section. So there is a timeline for your whole process, for the ST3 recruitment process. At the moment, you've just passed the self-assessment score. You should be able to put down your preferences either before or after the interview, and then you go through the interview. Interview scores are released, offers, and then you accept or hold offer according to your preferences. This is the proposed timeline from your advert. Some of the key dates are missing, but hopefully these are the key dates for your next important sections. In terms of the interview format, this is what has been advertised on the website. The interview is going to be remotely on Microsoft Teams. It's going to be made out of 2 sections. Each section is 10 minutes. So it should be 20 minutes in total. There are no breaks, and you'd expect the panel to be made out of 2 consultants, and sometimes there is a representative to ensure fairness. Sometimes the other representative would check your IDs and just make sure your connection is fine. But other than that, you'd expect 2 people conducting the interview. So this is what we know so far. Sometimes they just change the structure of the interview without telling us, but this is what has happened for the last couple of years. Hopefully it won't change much, but my advice to you is be prepared just in case there are any changes. Don't feel surprised, just stay calm. On the specialty recruitment website, it says 15 minutes. But I understand in the email you received, it says 10 minutes. So we'll just assume it's 10 minutes. This means that you have very, very little time to show your knowledge. You have to be prepared, and you have to have a structure when you speak. In terms of the interview format, the interview is made up of 2 stations. The first station is radiology experience and prioritization. And this is where essentially you show your radiology knowledge and your clinical experience. Station 2 is about coping with pressure and managing uncertainty, teamwork. In this station, this is the station that needs a lot of practice because some of us are not familiar with the types of questions that are being asked, whether ethical or situational questions. So you need to practice and you need to have a structure when you answer these questions. So we're going to talk in detail as much as possible about both stations. Before doing so, I just wanted to highlight some of the screenshots from the person specification. I think everyone needs to have a read a little bit about the person specification, just to get an idea about the sort of stuff that they're looking for and what stuff can they assess. So one of the things is your clinical skills and clinical knowledge. In this part, you can see that they want to assess that you are ready to start training at ST3 level. They want a safe radiologist that doesn't need to have lots of radiology knowledge as long as it is safe to start at ST3 level. And remember, ST3 is the third year of training. Most of the trainees would start doing on-calls independently and would be taking queries and questions from the other clinicians. So just keep that in mind. And you must have already signed this bit, which is the evidence of achievement ST2 capabilities. Again, have a read on these ST2 capabilities. You should know it by heart. You should know what milestones are required at ST1 and ST2. It would be nice to bring it up in the interview when you're talking about your experience. So I just took this screenshot from the most recent RCR curriculum, which is May 2023. These are essentially the milestones needed for each year to progress to the next stage. So if we are talking about ST3 level, then it means that you must have completed all these ST2 milestones. You are giving a score of competency at each milestone or domain. For example, basic image guided biopsy, you are required to be at level 2. For example, reporting CTs, you are required to be at level 2. So what does level 1, 2, and 3 means? This is what it means. So level 2 essentially means you are entrusted to act with direct supervision. Wherever you are required to complete level 3, it means you can interact with minimal or indirect supervision. So you have to show them when you are talking about your experience that you have at least achieved these levels or beyond. So if you go back to that milestone, so very few stuff needed to be at level 3. Conscious studies of lines and tubes, reporting plain films, and managing ultrasounds of the acute unselected intake. Just keep these in mind. If you want to read more, refer to the RCR curriculum. This is page 55, and the next one is page 49. These are some other screenshots from the personal specification. This talks about your academic skills. So most of these have been already assessed on your application. It is unlikely that they ask you about these on the interview. But if you do have some time to talk about your experience, you can expand. If you've finished talking about the clinical experience and you have more time, you have some time left, you can start talking about your research, your audit, and your academic experience, as well as teaching experience. Coping with pressure, this is what you're going to be tested in station 2. Essentially, they're going to give you some situations, some ethical tests and situational judgment tests, and they would check how would you react. Do you have a structure? Do you put the patient safety as top priority or not? So this is what you're going to be tested, as well as, of course, management and leadership skills. This is what you're going to be tested in station 2. In terms of commitment to career, this is something that they do for ST1 interviews. It is unlikely you'd be tested for this in ST3 interview, but just prepare these sort of questions just in case. So what does commitment to career means? It means, why are you committed to radiology and why have you chosen radiology? Just have a read about these kind of questions just in case, but it is unlikely you'll be asked about this in the ST3 interview. I thought I'd also give you a bit of hint about the training structure in the UK. So typically the training structure is made up of 5 years. And if you've chosen interventional radiology, IR, as a subspecialty, you would get 1 year extra. So you'd do a total of 6 years. The first 3 years, ST1, 2, and 3 are usually you do general radiology training, and you have to complete part 1 FRCR by the end of ST1, which I'm sure all of you have already completed as it is mandatory for the application. You also need to complete part 2A before the end of ST3. And this is a critical progression point, which means you cannot progress to ST4 without completing the FRCR2A. In terms of the other 2 years, ST4 and ST5, these are usually subspecialty training. You would choose your subspecialty, whether cardiothoracic, breast, neuro, or whatever. And then you would aim to complete the FRCR to be within the ST4 years. So going back to the interview format, we said we've got 2 stations. Station 1 is radiology experience and prioritization. Station 2 is coping with pressure and teamwork. So in terms of radiology experience, this is what it says on the advert. You will be asked to discuss your clinical experience up to date, particularly in respect to areas covered with on-calls and procedures. So as you can see, they are really keen to test your knowledge in terms of on-calls and interventions related to ST3. They want a safe radiologist who can just integrate into the system and be ready to be part of the team and do on-calls. They might ask you, it might go either in a direct way. So they ask you direct questions. Do you have experience in that? Do you have experience in that? Or they might just ask you a general question and leave it to you. For example, talk us through your on-call experience. You have to be prepared for both types of questions. If they ask you direct question, there is minimum stuff you can do. You have to answer in a direct manner. But if they ask you in a general manner, you have to have a good structure to talk through your experience. So have a structured response, talk about all different modalities, talk about adults and peds, talk about level of independence according to what we've said in the RCR curriculum. Talk about the interventions you can do. Make sure to stress on the aspects relevant to the first 2 years of training, such as training in trauma center. It would be a good point if you've trained in trauma center. So this is a suggested structure. If they're going to ask you a general question, you can start talking about quickly places you have worked at, such as major trauma center or university hospitals. You can talk about the types of scans you're reporting, CTs, X-rays, MRIs. It would be nice if you have numbers, if you can talk about the level of independence, your subspecialty training. They might ask you specifically if you had any formal training in a subspecialty, and this happened 2 years ago. They will ask you about interventions, what kind of interventions you do, and if you do them independently or under direct supervision, your on-call experience. And if there is a bit of time, they might ask you about non-clinical, such as audit research and teaching. So have a structure in mind and just practice the timing, because it is very tricky to cover all of this in 5 minutes or less. In terms of the marking scheme, we think possibly this is the marking scheme they have. They will mark you on the on-call experience, and then they will mark you on the interventional experience and subspecialty training. On-call experience, make sure you show them that you're safe to cover and start at ST3 level. You can do at least CTs, X-rays, and acute ultrasounds independently. MRI you can do with the help with the consultant. That's all right, no problem. In terms of interventional experience, be honest and just mention the things you can do and what things you can do independently. In terms of the subspecialty training, there is a little you can do. To be honest, if you had formal subspecialty training, then you have it. If you don't have it, then you don't have it. So I think the next part is prioritization. So I will leave this to Dalia.
Hello everyone. I'm Dalia. I'm one of the ST3s at the Northwest, and I started in August last year. So I was exactly at the same position at the same time last year. So I'll just share my screen. Can I share my screen, Mohammed, please?
Yeah, do you want me to unshare?
Yes, please.
Yeah, I think you're sharing the screen.
Okay, I'll just go to the prioritization part. And okay, so before starting, I'll just take this chance to say congratulations for everyone, and just stay positive. You have earned the right to be there. As long as you have reached the interview stage, that's a very good point. So congratulations. And I've just written down some points out of the presentation. So first thing, first impression matters. So when the interview starts, try to have like a very good first impression. Like body language, I know it's virtual, but you can show your energy and you can show your like enthusiasm with eye contact, smile, try to keep or build a rapport with interview panel. And that's a good thing to start with. And always think positively. Person specification is again a life-changing. So if you can read the personal specification very well and try to tailor your answers according to the personal specification. So if they ask you about your CV or about your background or about anything, just try to tailor your answer according to the personal specification. The other thing is sell yourself. That's a common phrase that we use in the UK. So in the interview, you are actually selling yourself, trying to show all the positive attributes that you have, trying to show that you fulfill most of the personal specification criteria. That would be another good point. And as I said, try to tailor your answer to the personal specification and adapt to the grades that you are applying for. So we are applying, you are applying as ST3. So as Mohammed showed you in the RCR curriculum, go through the two tables and see what's exactly expected from you at the end of ST2 and beginning of ST1. So that's what the panel are expecting from you. So try to show them that you have done whatever is expected from you and that you are at the correct level of applying as ST3. So don't like over like inflate yourself or undermine yourself as well. So the first station is about first part, Mohammed said it, about CV, and then there will be another part about prioritization. So in the prioritization section, you will be given a number of short requests to prioritize and discuss how you would manage case and why. So I'll tell you what happened last year. So it was not really like to put them in order. It's not like scenarios to put in order. What happened to us last year? We were given multiple scenarios, and you are expected just to. Every scenario was just like a line or two, so very short statements, saying like 15-year-old female patient coming with severe right lower iliac fossa pain, and CT is requested. That's one example to say like there were 5 statements, and they were shown like in a piece of paper. And one of the tips is that what happened last year is that they showed them like this, and they give you like 1 or 2 minutes to go through the sentences, and then that paper disappeared. And when I tried to ask the examiner to show it again, he said, no, you should have taken notes. So my advice is when they show that screen, if you can just write it down or take a screenshot or something, just to keep it in mind how you will discuss every one of them. It was not expected to put it in order like 1, 2, 3, 4. No, it's not like this. It's just to go through one by one and tell the panel what you're going to do if you are on call and get that request. So you should have a system to review. Is that the correct scan? First thing you will look at, is that the correct scan? Because one of the examples that was asked in previous years, or that can be asked in any like interview, if you a person is presenting, like patient presenting with coda equina symptoms, and CT is requested. So you will think, is that the correct scan? Is CT the correct scan that should be done for the patient, or MRI might be better for the patient? Another thing, has it been requested by the correct person? Try to check the age of the patient, because sometimes you might find that a girl 12-year-old and CT scan is requested. You might think, is ultrasound a better option for this patient? So you'll discuss with the clinician why not to start with ultrasound if available. Pregnancy status, is the patient pregnant or no, if we need to do a pregnancy test or not. Renal function, eGFR, if we are going to give contrast, that's another thing to think about. If the patient has contraindications like lactation or pacemaker, a good point about pacemaker, and I think it's good to read about that many pacemakers at the moment are MRI compatible, and there are many like prostheses and metallic prostheses that are MRI compatible as well. So it's not an absolute contraindication to MRI. So if we need to do an MRI for a patient with a pacemaker, we usually check with the patient at first, or check from his notes if he has whatever device he has is MRI compatible or not MRI compatible. And always ask for more information if needed, if you need to ask more information. So just try to show the examiner that you are looking at the whole thing about the patient, and including the age of the patient, pregnancy status, is that the correct scan, is there any contraindications or not. So some examples here, like medical team wants to do a CT scan for a patient who have a mass on the chest X-ray, oxygen sats normal, patient stable. And neuro wants to do an MRI for a patient with a low back pain or coda, and plus or minus, patient has a pacemaker. Surgical team for a 15-year-old female with right iliac fossa pain and want to do CT abdomen pelvis. Is that the correct scan? Can we start by ultrasound if you have availability for ultrasound? If we are going for CT, have we checked the pregnancy test, or is the patient could be pregnant? Sorry. So if patient in childbearing age, it's worth checking for a pregnancy before doing a CT scan on a patient. Urology want to do an ultrasound for a 16 male with right testicular pain and suspected torsion. Is that, I understand ultrasound is a correct scan, but do we really need to do it? Because testicular torsion is mostly like a clinical diagnosis. And if the patient is suspected torsion, it's better to take the patient to theater. And also consultant calls and wants an ultrasound pelvis for his wife who has vaginal bleeding. They might give you something like a consultant wants to do an ultrasound for his wife, or a consultant calls you during your on call asking to do for a scan for his like friend or neighbor. Is that appropriate? You will think, is that an appropriate scan? Would you vet the scan, or would you speak with the consultant and tell him that the patient has to go through the normal pathway? If the patient is coming with vaginal bleeding, has she gone through the A&E? Has she been seen by the gynecologist? And that the request has to be requested by the appropriate team, not by the consultant who is her husband or who is her friend, or whoever is asking for the request. Okay, so station 2 is coping with pressure and managing uncertainties and teamwork. So you will be asked questions to assess how you work under pressure in different scenarios. And teamwork, you will be asked about your experience of working in a team. So at the end, we'll show you the interview preparation book, which is like a generic book for ST preparation and medical interviews preparation. There are many good examples, and it's better to be prepared before you go to station 2, because station 2 needs that you have a structure in mind, how you will build your answer. And the other thing is that you have like prepared a scenario for each question that they might ask you in station 2. So it's important to have a structure in mind to answer these questions. The more you practice, the more you will answer naturally. And remember, STAR structure for situational questions. So when they ask you about a situation, tell us about a situation when you were like, for example, they might ask you, tell us a situation when you showed leadership. So for situations, we tend to use the STAR technique. STAR stands for situation. What is a situation? T, what's the task? What's your task on that situation? A is the action, and R is the result or reflection. So you'll start by S, like describing the situation. Don't say STAR or don't say STAR. Just start, just formulate your answer in that structure. So you will describe the situation. What was expected from you, or what was your task or role in that situation? A, what action have you done? And R is what is the result? What happened? How did you reflect on that, or what happened after that? And there's another like SPIES, which we use, SPIES structures we use for ethical, and sometimes in some situational questions, which stand for SPIES is to seek info, patient safety, initiative, escalate, and support. You will find loads of examples on the interview books, so read through them, and I suggest that you prepare 2, 3, 4 like scenarios in your mind if you are asked about one of those situations or how to manage an ethical scenario. So situation, this is questions about asking for example. So as we said, situation, explain what the problem was. Task, as a result, what did you seek out to achieve? Action, how did you do it? Result, what happened at the end? And where you example like where you dealt with a difficult colleague, where you have dealt with a difficult or angry patient. Give us an example where you had to prioritize your work. So these are different questions that we can use the structure, the task to answer this question. So you will, if you're like given a question to how to deal with difficult colleague, you'll just try to formulate it in your answer in the STAR technique. So what was the situation? What did you do at that time? Or what was your task at that time? What action did you do? And what was the result? And always remember that patient safety is your primary concern. And just say it out loud when they ask you about something or scenario or ethical dilemma or anything. If there's anything that's about patient safety, just say to the examiner, I'm keeping in mind that patient safety is my main priority or my primary concern. Handling stress is another thing they might ask about in interview. They might ask you directly how you manage your stress, or they can ask it in like, give us an example of a stressful situation, and you will just go through it and explain what stressful situation you've been through, like a very busy on-call and how did you manage an on-call. Or you might be asked it in another way, tell us about a situation where you had to work under pressure. So, and how did you manage the stress at that time, and after what happened, how did you de-stress or preparing yourself to stress, like relaxation and all this kind of stuff. Teamwork. So you might be asked about teamwork, like directly. What do you think? What are the criteria of a good team? What are the main attributes of a good team player? What are the main attributes of a good team leader? What's the difference between team leader and team manager? But I think they will ask you more in terms of scenarios, like tell us about a situation where you showed like that you are a good team player. Tell us about a situation you have showed good leadership abilities. So again, it's better to just be prepared in advance and have your scenarios prepared in mind. So when you're asked a question, you are like ready to go. Give us an example of a recent situation when you have participated in which teamwork was important. What role did you play? How did you learn? What did you learn from this experience? Describe a situation when you demonstrated professional integrity as a doctor. Give us an example when you showed leadership. There are loads and loads of examples on the books if you read through it, and try to just make your own from real life. I mean, Everyone has gone through difficult times at work. Everyone has dealt with like angry patients or has gone through difficult situation. Every one of us have showed good time management in some like situations. So just try to think about it and practice it and keep it in mind and formulate the answer in a good structure, and it should be okay. General questions like ethical scenarios, like drunk colleague, mistaken report, difficult patient, as we said, clinical governance and academic questions. I haven't heard of anybody who has been asked about clinical governance, but of course it's good just to have a good knowledge about what audit is, what research is, what's the difference between audit and research, what clinical governance means, what are the pillars of clinical governance. So study materials, which we suggest here, I know it's a lot, but if you can just have a quick look at RCR or NICE guidelines. I refer tools on RCR. So I refer if you have RCR, if you are an RCR member and if you have an account on RCR, you can go and type I refer. I refer will tell you in each like symptom, like if a patient is coming with gallstones or a patient is coming with right iliac fossa pain, what are the examinations or that can be done for the patient, radiological examination, and which one is number one and which one could be number 2 or number 3. So I refer is a good tool. You might just go and look and search for the most common like presentations which can present to you when you are on call, and just have a look to see is CT number 1 or CT is the best or ultrasound is the best or MRI is the best, just to try to have something prepared ahead of the interview. Medical interview book. There are loads of books, but this one it's a very long book. I know it's many pages, but you don't have to like study it by heart. Just have a quick scroll or a quick scan through the book. Try to highlight some phrases to keep it in mind, and just take some like examples and try to make it in your own, or like apply it to your own practice. So in summary, Mohammed, do you want to continue, or shall I continue?
No, go on.
Okay. So in summary, just know your CV inside out and summarize your strongest points and reporting numbers. And as I said, try to tailor your answer to the personal specification. Last year, about CV, they didn't ask us to go or to take us through your CV. I think sometimes they just start by asking you guys to take us through your CV or tell us about yourself. In that situation, you will start speaking yourself. But I think what happened last year, and I think what will happen this year, because of the time limits, because they have reduced the station to 10 minutes. So I think they will just ask you straightforward questions. They will not tell you go through your CV, because they already have your CV and they have everything about you. So they just might ask you straightforward or direct questions at what happened last year. They just said, have you done cardiothoracic? Have you done breast radiography, radiology? I mean, have you done any GIT? Have you done any neuroradiology? So it was just questions with yes or no answers. Do you have experience on call CT reporting? Can you do it dependently or independently? So it was more like directed questions, not like an open question. Second thing, to have a structured answer to the ethical scenarios, as we said, and patient safety is always top priority. Have answers ready for situational scenarios. Prioritization, remember your day-to-day practice. Remember to always ask the important questions and have a checklist ready. Dig deep into every question as you do in your usual vetting. Interviewers want to hear some words related to the NHS, like the word MDT, PALS, PACS, RIS. That's common words that are used in the NHS. So try to familiarize yourself with these and use it when possible. And good luck and thank you. Thank you, guys.
Well, that was brilliant. Thank you,
Thank
Mohammed
you.
and Dalia. Can you stop sharing the screen,
Yeah.
please? Okay, cool. Thanks. Right. So if you have any questions now, we can start taking questions and answering them for you. So you could put them in your chat box. If you're able to raise your hand, if you want to speak, that's fine as well. We can do that. No questions. Everyone's very happy with the presentation.
There was one question.
Okay.
Oh, I can't see it now. I don't know. I think it was more related to they're asking, will they test your clinical knowledge or just from the answers? Would your clinical knowledge be tested, or are we tested about our own call or procedural knowledge, or we are simply asked about experience and marked accordingly?
Okay, so shall I answer this one, Dalia?
Yeah, please. Yeah.
So they do not typically ask you like direct clinical knowledge questions, if that's your question. But if the question, for example, is about an aortic dissection scan, you might be expected to know what is the protocol for aortic dissection. That's all. But they're not gonna ask you what do you expect to see in aortic dissection. So it is about your practice during the on-call, vetting and accepting scans and protocoling. That's what has been happening for the last couple of years.
Right. So there is a question from Smita about prioritization station. Would we be asked to arrange the order on the basis of urgency, or would we be asked to comment on each of the requests?
Last year it was just to comment, and I think the previous year with Mohammed it was just to comment on every scenario. It wasn't to put scenarios in order, no.
Yeah. So nevertheless, the candidate should be prepared. This is just based on what has been happening about the format and the theme, but you have to be prepared. If they change the format or if they bring in a new format, that's absolutely fine. Don't be taken aback. So if they ask you to prioritize from 1 to 5, which is the top priority, which is the least priority, you should be able to do that. It's usually based on common sense. Okay, so don't get too worried about that. Next question is, in asking about experience, do they ask us radiology questions?
So no radiology questions will be asked. You'll be asked about your experience, what kind of on-calls you cover, what subspecialty training you had. We did not have any radiology questions.
Okay, and then Hira has asked what kind of ethical questions can be asked. Any examples? So I can say something like that. Abira, do you remember any of those ethical scenarios that we had?
So ethical scenarios are basically either they would be like how to deal with a difficult colleague. They normally sometimes come up, or if there's a challenging situation where the consultant is coming in drunk, or you feel like consultant is not safe to do the procedure. So it's to do with either patient safety or a patient has made a complaint. So it would be like something along those lines. And the interview books they got lots of questions. So yeah, I would say difficult colleagues, difficult patient also sometimes. Sometimes if radiology related, then it could be like a contrast reaction has happened to the patient and they didn't check it beforehand, or a wrong patient has been scanned by mistake, or a wrong modality has been done, like a patient needed a CT thorax and he got a CT abdomen and pelvis. A pregnant patient has had a CT scan. So just along those lines. So it would be related to patient safety, patient or difficult colleague, or a challenging patient, or a difficult radiology related scenario. And the interview books have lots of those questions.
Yeah, that's quite thorough.
Some examples like a consultant asking you to vet a scan for his relative. That's one of the ethical questions. And breaking patient confidentiality, you get a relative asking for to give him details about the report for his brother or sister. So anything about breaking patient confidentiality can come under the ethical scenarios. having a colleague who has like family issues and coming late to work every day, how would you deal with your colleagues? So these all like examples of ethical scenarios.
That's good. Thank you. Yeah. For ethicals, please remember patient safety. Please remember to support your colleague, and please remember to say you will reflect on the incident. It shows that you have that introspective style. If there have been any discrepancies in that scenario, talk about REL meeting and highlight that it is a learning experience and not a blame experience. Okay. So again, like Abira and Dalia have said, these are very well covered in those interview books. Have a look at Radiology Cafe website on the interview questions. So they have got few examples of ethical scenarios there as well. Okay, let's move ahead. Moise has asked, if I say I do some procedures, can they stop us and ask us quickly to tell how would you do it?
No time. There's no time in the interview. It's very short, so I think they just need very short and to the point answers.
Yeah, it will be surprising if they start asking you individual questions like that, too deep into radiology aspect. So Hela has asked, mentioning that you have been a consultant overseas would affect the score negatively? Question mark.
I'm not sure, to be honest, whether it's a positive or a negative thing, but I would say that I would phrase it in a way that I'd say that I'm confident in the stuff I do, but don't show that you're too confident.
Yeah, remember this is an ST3 level, and as Mohammed has showed you, for in radiology in the UK, it is very consultant-led training, and you have to achieve a certain level of competency in every year. So even as an ST3, you're expected to report plain films or do ultrasound lists or CT on the on-calls. I don't think nothing more than that. So you're not, or probably some basic procedures, but you're not signing off all the CTs and MRs independently. So you have to understand the limitations. Patient safety is the main concern, especially if you're overseas, you have not worked in the NHS. Don't try to say, I've done like thousands of MRs and CTs by myself. Even if you do, that's fine. But understand there are limitations when you are entering the training. You have to be a trainee, even if you're coming with a 10-year experience. So be careful in what you say.
Okay, all right. So,
Also, I
yeah,
just
go on.
want to stress on one factor that I think you've just been told what the stations are. The webinar that we have covered is basically what it was in the last 2 years. I suspect they might change the stations completely, as they have done for the ST1 radiology interviews this year. And they were asked like different sorts of questions, and the trainees were taken aback because the questions were not, they were not familiar with some of them. So you have to keep your interview preparation really broad. Don't just stick to what we have said in the webinar. This is just to give an overview that you can be asked prioritization questions or ethical scenarios, or like, you know, your on-call experience prioritization. You may or may not get a prioritization this year. I don't know. We don't know. So that's why we have given you an overall like experience from previous years. But yeah, we don't know what's coming up. So just try to keep your preparation really broad.
Yeah, that's a very important point. And don't get too worried. It would be something very basic that they would want to ask. It's just that if you're not expecting that question, then you may feel that you may have to think on the spot. But if you note down top 3 points in your CV and you are able to talk about those, you can almost fit into most of the things, be it research, leadership, management, what activity you have done, what teaching you have done, and things like that. So don't worry too much about it. Just learn to speak in a fluent manner and to deliver your answers. Also have a look at our webinars for the ST1s that we did, because many of our trainees presented and went through how to approach ethical scenarios, how to answer specific things, hot topics in radiology. So those are all important things that you could also use in your interviews. So you go through that webinar as well. Okay, someone has asked, okay, how important is subspecialty experience? Does it have to be a formal fellowship only, or can subspecialty rotations during residency count? Avira, do you want to take this?
Yeah, so in the UK, like as I said, for 3 years is core training. First year depends upon different deaneries. Sometimes it's more like block rotations, like you will have an ultrasound block, CT block, plain film reportings, and like, you're preparing for your anatomy and the physics exam, so you have regular teachings. After that, you start your subspecialty blocks. In some deaneries, you may start from ST1, otherwise in ST2 and 3. So you will have core blocks normally of 3 months. In most of the deaneries, could be 4 months. So you will have a block of GI, then neuroradiology, then chest block, then breast radiology, uroradiology, like all rotations. So you have to cover all the blocks in those 36 months before you sit for and you have to pass your exam before that. So it doesn't have to be like a formal fellowship, but you should have experience of different rotations. And when you're answering your questions, I would say just try to incorporate different types of subspecialty experience in your answer.
Okay, yeah, thank you. Right, so do we have, looks like we have answered most of the queries there. Anyone else? Any more burning questions? You will always have the opportunity to ask questions in our WhatsApp group as well. So we'll try and answer. Dalia and Mohammed are also there. So we'll try and answer questions before your interviews.
Yeah, and also as Asim has also sent the link for the webinar, I will also post it in the group. It's really good to listen to that. It will cover lots of hot topics and skill mix and lots of different things, especially if you haven't worked in NHS, then you must listen to the webinar. It would be really useful.